So we're in for a special treat. We're going to do a father and son over here. Okay, so clue us in, right? What's been going on with your health?
Well, I've been having problems with my back. My lower back has been hurting. I can't really sit for too long. And sometimes when, I'm standing and then go leaning towards my right, it hurts. It hurts a lot.
Gotcha. And how long that's been going on?
Almost 4 years.
Okay. And I'm trying to remember. So you both guys work in construction, right?
Yes.
Okay, so that's how you hurt yourself?
Yes.
All right. And okay, so fill us in, right? What's going on with your health?
My knee.
Okay, so what's going on with that right knee of yours?
When he's walking up the stairs, his knee hurts a lot.
Oh, okay. So if I remember correctly, so while you're going upstairs, this area right over here hurts you the most. Is that what you're saying?
Yeah.
Okay. All right. And the low back also been going on as a problem as well, right?
Yes.
Tender right there, huh?
Yeah.
Yeah, see, there's a lot of swelling right on the top part over here. Now, it's kind of hard to see over here because we also got some other tissues going on over here, okay? But the main deal is we're right at the very top part of the sacroiliac joint. And, yeah, he's already wincing his pain over here. It's very swollen right at the back, and it's gapped open right over here as well, okay? So, yeah, this is a very good indicator that tells us, yeah, this sacroiliac joint is right ilium. This is the one we need to correct on him. March. See his right side, that thumb, is supposed to go downwards. Okay, just like the left side. See my left thumb? It's moving just fine. Right side, not too well. And we'll go to PIEX. See, this one's going downwards. This one's deviating diagonally. Okay, so we'll go ahead, march. So sacrum is moving just fine. This one's moving just fine too. So as we see over here, it's not moving so well whatsoever going to the right side. That right hip is a problem. In your case over here, when I take a look and see over here, okay, you definitely have a foundational problem going on. Here's the gist of things. Normal, and I said straight. Does that look straight to you?
No.
So, what's going on here? Everything's rotated like this, okay? Swinging like this, swinging around like that. All because this right hip over here. Okay? This right hip, when I did some biomechanical measurements, I want to see this thing nice and centered. Okay, we can see this over here. See this plumb line over here? Okay,
yes.
Since you guys are both in construction, it's easy to understand, right? So plumb line, so it's centered right over here.
Yes.
See this over here? This shadow over here?
Yes.
That plumb line is supposed to be here. Do you see how much you deviated way off to the right?
Yes, it's a lot.
Yeah, that's not a small amount. That's significant. So plain simple language, okay, the way your hip did, okay, yours went this way and this way by a lot, okay. So what we see over here, this is PA4EX12, okay. So what these numbers mean, 0 to 1 millimeters misalignment, I don't care, okay. 2 to 3 millimeters, okay, we start to have a problem, okay. 7 above, we got a problem, and it's a big one, okay. 12.
Wow.
Okay, so not just a little bit over here, a significant amount, you're rotated like this way and backwards this way. So all that significant shearing force over there, all that rotation, is it any small wonder, since you're like this way, how comfortable is it to stay like this?
Yeah.
You're gonna have a lot of trouble walking around and standing this way, right? So that's help explain why you have a lot of trouble, going on this side and start to hurt a lot, right? So we gotta rebalance your foundation over here. Okay, let's just go. Next, a little more. Right here. Okay, walk around.
felt a little different.
Okay, what's different?
I don't feel the tension. I had like the tension when I used to walk.
Mm-hmm.
That was like grabbing me.
Okay. What other differences you notice?
Walking a little straight now because I was walking. I felt like I was walking sideways sometimes.
Sideways in which way?
This way because this part hurt it a little.
Mm-hmm. Keep walking.
Yeah, it feels different.
Anything else?
My over here doesn't hurt as much. The top part of my back,
Mm-hmm.
yeah, felt like the stress went out.
Ain't that something, huh? See, all we did was restore your foundation, and all the other little twists and kinks out there just worked itself out.
Wow.
How's this right now? Not that bad, right?
No,
So you're not flinching
a
anymore.
little bit. It's not that. When last time we just
Mhm.
touched it, it hurt
Mhm.
a lot.
So how's it now?
Just a little bit.
Well, how you like that? This fellow's moving in now. Okay, so we still see it's still deviating a little bit towards this way. And the reason why it's doing that because there's still quite a bit, as I explained before, there's still some swelling over here. So in a follow-up visit, okay, and this one, you do need to ice it down. Okay, 20 minutes, 3 times a day, ice it down, get the swelling down so we'll get more of the rotation out of this pelvis. That's why this thing's still deviating quite a bit. Not as significant as before, but it's still there. Okay, this is chronic and old. So it has a barely registering, but it's right there still, right there. Tender right here?
Le duele?
A little bit, right? What over here? Huh? How's this side?
Nothing.
Nothing. Because what I'm feeling right now is you have like a broad band swelling. It's like a speed bump. Feel that ridge? Going from bottom to top. There's a ridge over here. There's another one right over here. Okay. So when we took a look at the film, okay, over here, this indicates there's a base posterior sacrum, and that's what we're finding here as well. So on the left side, it's stuck. Right side's also stuck. See this over here? Normal, nice and straight. In yours, it kind of looks kind of straight, and then what happens up here? Leans over to the right side. Follow me so far? Why is that? Well, in your case, your sacral foundation itself is not stable and level. Okay. Yours is a specific type because I want to see the angle when we take a look at the sideways view. I want to see it over here. Yours is kind of vertical. Okay. So since it went vertical, and that's what we see over here, when we draw the lines over here, they're kind of parallel. There's supposed to be a little wedge this way. But since it's parallel, that's how we know this foundation is not backwards. This is the one we need to correct on you. So when I take a look at this right knee over here, what it's doing is this. It's wedged. It should be parallel. Just like what you see over here, this is parallel. Over here, it's gapped open on the outside. So that tells us this bone over here is involved. And the way this one's rotated, it's rotated going down this way. Okay. So this is a very common type of misalignment, what we call the PIEX tibia. So this is one we're going to correct on. Feel the difference here? Nice, strong, solid when we push it from the inside. We push from the outside. See how much give there is? You feel this? It's loose. That tells us there's problems on this side over here. That means the tibia, this bone is misaligned. So check the femurs. Okay, this is moving just fine. Rotating. See the difference here? It's stuck. It's just not rotating too well. So this one we confirmed already. That's a PIEX tibia over there. But here's what I want you to try to remember, okay? Try to remember how stuck this is, how it feels for this knee. Because after we correct your sacral foundation, because the way your foundation is, over here. It's stuck a little more to the left, but also mostly stuck this way. So because it's mostly stuck this way, and with a slight rotation, what do you think's happened to the knee? The knee is also being rotated as well. It's going on for the ride because that's where the foundation went. So when we correct this foundation, it's going to take a lot of pressure off of that knee over there. Okay, just relax it a little more. Can you do that? Okay, come on up. Okay, walk around.
Yeah, it's a little different.
What's different?
Look now, no have more pain, little.
Yeah, keep walking.
Yeah, I mean,
Okay, so what's
Little more
different?
better.
Yeah, a little more better of what?
la rodilla,
Yeah.
but his knee.
Hmm?
Say he's a little better. His knee got a little better.
Feel that difference now? See over here? It's not as loose as before. Now, as we see over here, this joint capsule is very swollen. So before we can set this knee back in its place, we do need to reduce the swelling a bit before we set it. Just let it go. Just let it relax. Just pumping the fluid out of the way before we set this fella. We're applying a cold pack to this area because we suspect that possibly it may have a Baker's cyst, or at the very least, this joint capsule is very swollen and very tender. So we're going to apply the cold pack, cool it down before we set this fella. There it go, right here. There it goes. Okay, walk around. How's the knee?
A little more better.
Remember when he was standing up, when he was sitting down, his knee. He was complaining about his knee hurting a lot. But now he gets up, normal.
Yeah.
Pretty good, huh?
Yeah, thank you.
Oh, you're very welcome. Feel that now? Much more stable. See this? No give. Nice, solid, stable. Feel that? Nice, strong, stable. This is a lot better now. Much more strong and stable in place. See, now this was swiveling. See, we can rotate it forward and backwards. Listen, what's going on with that finger over there? What happened?
Some fall down.
And?
I don't know, so.
So point to me. Where do you feel the pain? What do you have a lot of trouble doing?
Over here.
Okay. And which is what? Well, you have a lot of pain over here?
Yeah. Yeah. Oh.
Actually, let me test something. Pain? No. Good. It's not fractured. When did this happen? 2 weeks ago?
Yeah, 3 weeks ago.
Okay, hold on. Relax. Relax the elbow. Okay, nice and stable. Relax. Yeah. There we go. There's a piece. Okay, loosen up some more. Good. Okay, we corrected that. Let it go. A little more. No. Okay, let it go. A little more. Just really stuck. piece. Okay, this is very swollen. Okay, so we got this part to go. Okay, I know. Right now we're pumping all that fluid out of the way. There we go. See that? Now it's moving better. Now we're gonna set this back. I know. Hold on a second. There we go. Just let it drop a little more. There we goes. Okay. Now walk around a bit. I know. Just walk. I'm gonna walk.
Oh, fuck. That's good.
Yeah?
Yeah, because like this before.
Mm-hmm. Now how's it now?
It's okay.
How's the pinky feeling right now?
Too much pinky.
Yeah, it's good now.
It's good, huh?
Yeah.
All right. It's still swollen, so we're still gonna ice it and cool it down.
Too much different.
Oh, what's different about it?
Now it looks straight.
Okay, let's take a look. So you got full range mobility right now. How do you like that? Huh? Now this fella's still swollen in there. Okay, so so we could tell because when I set that fella, it didn't exactly make a loud little noise over there, a loud pop in there. It didn't do that because there's a lot of swelling in there. So when you get home, what you do is you gotta ice that fella down. Okay, just like before, just 20 minutes. Make sure you have a wrap it in a cloth. Okay, 20 minutes, 3 times a day. Get that swelling down. It's gonna heal up just fine.
All right. Thank you.
You're welcome.